I started therapy in the third grade because of the suicidal thinking, but it was not consistent. It happened and then it would stop, and then it would happen and then it would stop. It was mostly because my mother was a young mother, in her early 20s, and she didn't understand how a child could feel the way I was feeling. And so, looking back on it and talking to her now, she was afraid. And so if she had had some support, and somebody to talk to her and say, this is what suicide is, this is why this child could probably be thinking this, and this is what you might need to do differently at home, I think those type of things would have helped tremendously. One of my favorite sayings about parents, because I do some bullying work as well, is for parents not to be their child's first bully. And for me, growing up as a child that questioned my gender and my sexuality a lot, my parents didn't understand that. And so they were kind of almost like my first bullies because they wanted me to be this little girl that I wasn't. And so having to work through that led to a lot of suicidal thinking for me. The education around suicide, basic 101, what is suicide? What are some of the thoughts that children or young teenagers might have, thinking about suicide? And helping the parents, educating the parents about it, but also talking about the family dynamics, because a lot of the issues that bring up suicidal thoughts may come from within the family. And so a lot of times parents need to learn how to be able to cope with those emotions that they're feeling in connection to their child being very sad and thinking about suicide. Some of the other things are also culturally. My dad is West Indian, and so the culture around mental health issues is hush, shame, and silence. And so you have to also understand when you're dealing with different cultures, how each of those cultures handle mental health. For my sisters, it wasn't them necessarily learning Suicide 101. It was them learning why I was feeling the way I was feeling. And, even though we grew up together and they saw me every day, they never understood why I felt the way I felt around my gender. And so after the first suicide attempt, they wanted to know, because they knew that is where a lot of the pain came from. It's hard as a young person to not want to be here because you are so young and you know that you have so much life to live. And so to have those thoughts, are very hard, and you don't want to share them with anybody else because you're like, okay, if I share these thoughts with people, they're probably going to lock me up somewhere. My third grade teacher, Miss Rosen, in Brooklyn, New York, and she was the first person that noticed that I was sad, kind of like, not participating in class activities or socializing with my classmates. And so she was the first person to say, something is different, something, is going on. And so she talked to my mom, and she was able to get us into therapy. So that was one of the first crossroads, somebody actually noticing and then taking action. Instead of saying, oh, I see something different, but I'll let the family handle it. You'll hear a lot of people that think about suicide say that if they just had that human connection, that would have stopped the thinking or even the attempt itself. For me, when a person asks me how am I doing, and they actually stand there to wait to hear how I'm doing, that opens the door for me. I see so many people ask people how are you doing, and they're walking as they're asking them, and so just that intimate connection helps a lot. The therapy was the life jacket for me, being able to talk to that person after my initial attempt, and being able to go back for weeks after that and be able to talk and know that it was a safe environment, that this person wasn't judging me for feeling the way that I was feeling. It's almost like having a blanket wrapped around you, because you're in this apartment building that's 6 stories, a couple of dozen apartments, but you know that on each floor there's at least 3 other families that are closely connected to your family, and you can go to those people at any given moment in time and get the same type of love and support that you would get at home, a same type of hot meal, have other siblings to play with. And so that was really important growing up, especially when you're living in an urban environment where there's a lot of poverty. Sharing resources was really important. I practice meditation every day. I do yoga, and I also receive massage therapy and acupuncture to help with all the anxiety and especially the thinking and the depression. So those holistic therapies help a lot. But I also have a RAP plan, which is Wellness Recovery Action Plan, and it's something that I've used for the last 15 years. I haven't been hospitalized since I started using a RAP plan. And so I basically use it as a suicide prevention tool. It's a living, breathing document that I write in how to keep myself healthy, things that I need to do to keep myself healthy. I have a list of supporters. I have a list of things that I need my supporters to do if I ever can't take care of myself. So the RAP plan is my suicide prevention plan, and it's been very helpful over the last 15 years.
Part of my story is that I was kind of born at the wrong time in some ways. I experienced a lot of early childhood trauma prior to the age of 5, which we now know as a result of the Adverse Childhood Experiences study and all of the additional research that trauma that happens in those really early fundamental years can have extreme and lasting impacts on mental health, physical health, social impacts. But they didn't know that back then when I was young. And so essentially my childhood trauma, I was in treatment, but my childhood trauma was not addressed. A lot of the symptoms and things I was experiencing, which I now know, and it's so clear, were a direct result of that trauma, were never addressed. So it was always kind of looking at the outward manifestations, the behavior, rather than what was driving it. There were actually 2 crossroads that I can think of. The first one is I was around 18 years old, and at that point I had been in and out of mental health care. I had been struggling with suicidality for a long time, probably since age 7. And I was in this horrible group home. That's where my treatment team said I needed to be. It was dirty, decrepit, people were not getting help. It was a snake pit of a group home. And I had attempted suicide there and went to the hospital. 72 hours later, they spit me right back out to that group home. That was actually driving my distress, that environment. And I just remember sitting on that couch and looking out the window, and it was dirty and grimy and dark, and I just picked up the phone. It was like a moment of grace. I don't know how else to describe it, that I reached out and I called a family member, my grandmother, and I said, you have to get me out of this place. And thank goodness she did, and my life really started to turn around. When I was in community college, my second crossroads was, I was about 19 years old and had just kind of gotten back into school after a lot of years of disability and disruption. And I had this guidance counselor who knew all about my mental health history. He knew about my history of suicide, and he was so supportive and so wonderful. And he said, we have this program where Vietnam vets who are returning to school after a long absence, many of them who had themselves struggled with PTSD, mental health issues, suicide, they're returning to school, trying to get their education, change their lives, and I'd like you to be part of this orientation program. And I was kind of resistant at first. I was sort of like, what do I have in common with these old dudes? I'm 19 years old. But he knew something that I didn't know. Which is that we were all trauma survivors in a way, and that we had much more in common than we didn't. And so I started to do this program, and I started having these coffee meetings with these Vietnam vets, all these old dudes. They were wonderful. And we would, share stories and talk about our struggles, and that was my first introduction to peer support. And we didn't call it peer support, it was just an informal thing that we did, but we supported each other through this return, this transition, really back into society, back into education. And it made me realize that, first of all, I can help people, like I have something to contribute, because I'd always felt like a burden on everyone around me. And second, that helping other people actually helped me. I had to go to a continuation school for like the bad kids because I had fallen so behind in my regular school. And I noticed that a lot of the kids at this school were using. They were using in the classroom. Like the teachers, bless their hearts, they were checked out. I was trying to stay sober and finish high school. So there was this one teacher that I felt like I could trust, and I talked to him and I said, listen, I can't come to this school. If I come to this school, I'm going to pick up, I'm going to start using, and who knows where that's going to take me. I want to move on with my life. And he met me where I was at. He said, well, let's think about what we could do. So I did sort of like a home study program almost, where I stayed at home with my family, completed my assignments, came in just once a week to hand them in, talk to him. He was available in between to ask questions. And he just, the fact that he met me where I was at, didn't try to force me to conform, that made such a huge difference, because I did end up being able to graduate. I did like half my junior year and my whole senior year in 6 months, and graduated. And the staff cried when I got my diploma, because so few kids would graduate from that school. Again, I think the communication skills are critical. That if a young person is courageous enough to share that they're feeling suicidal, I mean, we would hope that they can even talk about it, that we not respond in a punitive way or with judgment, but with support and with resources. I was given a lot of diagnoses, I was given a lot of medication, but I wasn't given a lot of coping skills, alternative coping skills, so I would self-harm, and people would say, stop doing that, but they wouldn't help me figure out what I could be doing instead. So then I turned to alcohol, and I turned to, So it really, unfortunately, wasn't until adulthood, and pretty deep into adulthood, that I learned some skills for how to get and stay healthy. In my late 20s, I had kind of hit the worst crisis I had in a while. And it was a big wake-up call for me. And I had never been attracted to mindfulness or anything like that, but I decided to try it and start practicing meditation and start really kind of taking holistic care of myself, kind of mind-body strategies, really looking at what I was eating, just really kind of reevaluating everything. And I would say that the mindfulness was probably the most helpful for me, because it really taught me that I am not my thoughts. That even though my thoughts can be very compelling and very scary or very wonderful, I am not those thoughts, and that I have the ability to observe them, and I don't have to act on them, and that the more that I practice, the easier it is to sit with the discomfort and not act on it in a destructive way, whether it's through suicidal behavior or addiction or anything. As I mentioned, mindfulness has been a huge technique, and breathing and mind-body awareness, all those kinds of things. But I would also say creative outlets have been huge for me, just in dealing with distress, or also just in preventing distress. I started doing spoken word poetry when I was in my 20s, and I've done various kind of forms of creative expression, like blogging, and recently I've gotten into storytelling. But I think the key is that we really need to stop asking young people all the time what's wrong, and take, that's important, but to have that be the only question, I think we need to shift and say, what do you value? What do you love? Some people, young people will say, I've never been asked that question before, And when you get some answers to that question, you can start to know at what might be helpful for that person in terms of skills, therapies. It kind of guides, I think, treatment when we talk about what's right with a person, even though they might be struggling enormously. there's always strengths, there's always protective factors, and I think the more we can emphasize those, the better outcomes we'll see.
Garrett was a little boy we adopted as an infant. He was handsome, he was kind, he was thoughtful. They found that he had a very high IQ. He tested at 140, and yet he had severe dyslexia. And that caused him endless frustration in growing up, and I think ultimately led to his struggle with self-worth. It's something that he hid very well, and we didn't know about it really until he was applying to serve a church mission, which eventually took him to England. And on the application, he checked that he suffered from depression. So we spoke about it, and he told us that since about the time that he was 10, that he worked very hard to mask the dark feelings that he had. Nevertheless, he went on his mission. He graduated from high school. He'd become an Eagle Scout. He was meeting these life goals that he set for himself. And then serving in a church capacity is something he always wanted to do. And they were not inclined to send him on a foreign mission if he was severely depressed, and he gave them assurance that he could manage it. And so he went to Manchester, England. And his supervisor there later told us that on days where he had particularly dark episodes, he would just tell his companion to do the talking, and he'd be there for him as best he could. So he was really, it was very important to him to put up a good public face, but he suffered terribly privately. We worried about how he could handle college, but he was determined to go and to live with his missionary buddies. But it didn't take very long until he started manifesting what we now know as suicide ideation. And without his parents, without his home support system, I think he quickly began to descend into very dangerous places. When his roommate called us and said he was worried about Garrett, we got him to a psychologist. I regret to tell you that I don't think either myself or Sharon realized the extent of his struggle. And that seemed to be working, but we took him on it was actually a Senate trip that I had in back to Britain. And in that time we had with him, driving around his old areas of missionary labor, he began to really manifest the extreme highs and lows that it seemed, a common symptom of those who suffer bipolar or manic depression. And we began to talk to him about, we're really concerned with your up and down behavior. And he really broke down, and he told us that he just wanted to go to sleep and never wake up again. And so I asked him, do you have suicidal thoughts? And he said he did. In retrospect, I think he probably really hid as much as he could from the psychiatrist and the psychologist, because we debriefed with them afterwards, and he did not tell them all that he told us. They ought to know the signs, the kinds of things, behavioral things, which can indicate there's an underlying problem that they should seek out professional help. Things like if a child no longer cares about former passions that they would have, hobbies, they don't care about their appearance, they gain a lot of weight or they lose a lot of weight, they're giving away prized possessions. These kinds of things are indicative of someone who's thinking about suicide and of very serious mental illness, and if caught early enough, can save their lives. Knowing what we know now, and knowing what psychology and psychiatry are learning about the human brain, that had we identified this early enough in his life, separate and apart from his dyslexia, I think Garrett would still be with us and would still be a very productive and member of society, and the sweet boy that he always was, and no doubt would have been a great husband and a father. But he had a lethal disease, and had there been systems in places to help parents like us who did not know what they were dealing with, I have no doubt that Garrett would still be an esteemed member of our family and our community. All of our children, we've had their eyes checked and their dental appointments and their physicals, but it never occurred to us because Sharon and I are very upbeat people, and we've never experienced that, and so it never occurred to us to have him checked at a psychiatric level early enough that we could have been there in an effective way. Too many parents know as little as we knew about what we were dealing with. And had there been markers along the way and ways to identify these kinds of identifiable problems and preventable illnesses, it would have been enormously helpful. And I think that this has to be a constant theme, that we don't stigmatize those people, but we recognize it as a legitimate illness, just as heart disease or cancer, and one that is preventable, and one in which we can assist people to continue living happy and productive lives. And what I found as the private sector co-chair of the Action Alliance for Suicide Prevention is we have this patchwork of a safety net all over the country. And I think that there just needs to be a constant coming together and making sure that there are not too many holes in the blanket, that the patchwork be seamless and in both identification, accessibility, and affordability.